Thank you very much, Doctor, for your time here on ENCA. Now, the fact that we've forgotten about other vaccines that are needed around the world and 20 million children going without vaccines that are very important for their health just shows how unequal the world is.
Yes, good morning, and a good morning to all the viewers out there on this sunny Saturday morning. Yes, you are absolutely correct. And what is actually even more concerning is that in Africa over the past 15 years, although they have tried their utmost best to increase access to immunization, still only one of about 5 children in Africa have access to these extremely important vaccinations. People tend to forget that or do think that vaccinations is only now the COVID-19, but it's much, much more. And over the years, especially over the past 200 years, vaccines came into the market, and with that we saw a decrease in cholera, in mumps, in polio, all those very, very important diseases that actually are killers of people, whether it's children or adults. So it's extremely important to get your children vaccinated. But then please also remember that vaccines are there for your daughters around about the age of 10, 11 to try to protect them against papillomavirus. That virus is the virus that's predominantly responsible for cervix cancer. So you can protect your child against that. Then again, if we look at the people 60 and above, you then look at the flu vaccine. You look at the vaccine that we use to prevent pneumonia, severe pneumonia, the pneumococcus vaccine. There is the vaccine for people for shingles. If you have had shingles before, you would know how extremely painful shingles is. Yes, there's vaccines out there, but people tend to forget. And they tend not to think what is the importance of being vaccinated. It's extremely important. It's not only the COVID-19 vaccine, it's the other vaccines as well.
But also it talks about, the lack of access and the unfairness there, where poorer countries are left out in the cold. What is the role of the pharmaceutical companies? I mean, we've had our president, for instance, speaking at a World Health Organization virtual event yesterday, basically pleading with pharmaceutical companies to make sure that the technology that they are creating for the COVID-19 vaccine has no intellectual property barriers.
You're absolutely correct. So the theme of this year is vaccines brings us closer. So vaccines needs to bring us closer to the people who need this, but also to the pharmaceutical companies that are manufacturing these drugs. We know that they have a right to develop this after they have developed this. Vaccines for at least 10 years. This is not only in vaccine related, it's most of the medicine related, that they have the sole right to distribute, and only then can generics come onto the market. While we do understand that they had put in a lot of money and resources in developing these medicines, regardless whether it's vaccines or not, we also need to make sure that if you then want to keep for at least 10 years your sole right on this, then you have to look at your price. Then you have to bring down the price, especially for the third world countries that is actually in dire need of these medication. Your first world countries have a better catch-up safety net with their governments, while in the African, and not only African, there's other poor countries as well, third world countries out there, have a poor catch-up system. Most of the times the infrastructure at the hospitals are poor. It's long distances for these people to travel if someone is sick. So we need to bring down the prices. I fully agree with you on that.
And of course, the conspiracy theories that are going around about, for instance, the COVID-19 vaccines, your Pfizer, your Johnson & Johnson, which was halted, and then that ban being lifted, people hearing about blood clots, etc. How does this affect people's trust about other vaccines as well that might be very healthy for themselves and their children?
Well, yes, you will always have people that not know everything. They are experts in science, although they never read or written any scientific paper. You will always have people who are sitting on the fence, and you will always have the social media also spreading a lot of misinformation. So it's actually easy. If you have seen a child dying from cholera, malaria, or not so much malaria we don't have, but cholera, measles, and I have seen measles children die because they've not been vaccinated. If you have seen that once in your life, it's easy to make the distinction or the decision to vaccinate or not to vaccinate. You will vaccinate because there's no vaccine, there's no medicine in any country without side effects. There's nothing that is 100% great for you without any setback. So we need to accept that, and most of the times the vaccines, the side effects are mild side effects. I do accept that for the patient themselves it is not nice, and for them every patient always thinks that these are the worst, but it's mostly a sore arm, a bit of a fever that can develop, and normally it goes away within 2 days, body aches and pains and headaches. That's the most commonest type of side effects, and it's easily been treated by Panado or by ibuprofen or any other anti-inflammatory that would help relieve the symptoms. So if you weigh that up, if you weigh the risks of the vaccine against the benefit always will win, especially if you are in the medical field and you saw what happened to previous patients not being vaccinated. Even a patient, the elderly people who get severe shingles and didn't have access within 5 to 7 days to get to a hospital or to a doctor, those post-hepatic pain that they will sit with is for many years to come. It's excruciating pain. So if you weigh that up against a simple vaccine, I'd rather take my chances with the vaccine.
All right. Dr. Angelique Coetzee, thank you very much for your time.